go and press directly into the medulla oblongata. There is quadriplegia and there is respiratory arrest that can happen. More than 3 millimeters is highly risky, more than 4 is conclusive, but you must do this X-ray inflection and extension for all your patients with chronic rheumatoid arthritis, especially if they are intending to go for any surgery that requires general anesthesia. Okay, now this is psoriatic arthritis again, arthritis mutilans. This is what we have been talking about in the previous presentations, and this is bamboo spine. Now we will have the lights down a little. And this is calcification and then ossification of the anterior longitudinal ligament. Initially the discs are spared, but later they can be completely ossified and you develop what is called a bamboo spine. What about this? Acha, every picture has a story, so let me give you this story. This is a middle-aged gentleman going around with joint pain and deformities of the hand, and he has been around and was labeled. What would he be labeled? RA. Yes, okay. So he will be labeled as RA, and people thought that these were subcutaneous nodules. But if you look at this nodule, it is very superficial and creamy in color, subcutaneously. So what we did, when he came to the clinic, we stuck a needle here. I took the sample, rushed up to the lab, and it was a tophus. So he had polyarticular tophaceous gout, and so it was mistaken as gout, as rheumatoid in the past. Yes, on a polarized microscope, and I saw a whole bunch of crystals which were negatively bifringent. Okay, now young boy, maybe 20 years old, presents with drowsiness, high urea, high creatinine, microscopic hematuria, and this rash. Henoch-Schollen purpura. Okay, the thrombocytes are normal. The thrombocytes are normal, and he has obviously IgA nephropathy, microscopic hematuria, and this was Henoch-Schollen purpura. अगर ये बच्चों में इफेक्ट हो, 1 साल के बच्चे में अगर ये प्रॉब्लम हो Henoch-Schollen purpura, तो क्या प्रेजेंटेशन हो सकती है? Due to abdominal pain, due to intussusception, submucosal hemorrhage, फिर peristaltic movement की वजह से the distal colon invaginates into the proximal one. Sausage shaped.
Clearly, if you have a similar presentation, especially when you said that the patient was drowsy, high temperature, make sure that you don't miss meningococcal meningitis.
Of course. Yes. Very true.
This is very, very classical.
Yeah. The distribution of the rash is also very classical. It tends to be on the lower part of the body, the buttock and the leg. Okay. 40-year-old female presents with progressive discoloration of the toes and significant pain, has a long history of fever, and has similar but less significant changes in the finger. What's happening? So she has severe gangrene. This is dry gangrene, and this is secondary to severe vasculitis. The patient had actually vaginous granulomatosis. Young boy, 12-year-old, presents with 3 months history of fever, has multiple opaque shadows in the lung. Some of them show some cavitary changes. He has conjunctivitis and he has cervical lymphadenopathy.